This PowerPoint will be discussing the notification of periodontal condition. A patient may present with what we call healthy oral tissue or a healthy oral environment. This patient will have 1 to 3 millimeter pockets with no bone loss. The gum tissue is tight, stippled, and only marginal inflammation is present. What do we recommend? We recommend 6-month recalls, brush 2 times a day for 2 minutes, and floss daily. A patient may present with gingivitis. What indicates the gingivitis? 1 to 4 millimeter pockets with no bone loss, gum tissue indicating bleeding and inflammation, also known as erythema or edema. Our recommendation for this patient would be 6-month recalls, brushing 2 times a day for 2 minutes, flossing daily, use small circular motions at the gum line, and consider using a powered toothbrush. A patient presents with early periodontitis. The indications for this would be 4 to 5 millimeter pockets with slight bone loss. The tissue displays redness or erythema, inflammation, also known as edema, and bleeding. Recommendation for this patient would be scaling and replaning where indicated, 3 to 4 month periodontal maintenance recalls, use of a powered toothbrush 2 times a day for 2 minutes, floss daily, maybe consider an antibacterial mouth rinse such as chlorhexidine, and pay extra attention to brushing at the gum line. A patient presents with moderate periodontitis. Indications for this would be 4 to 6 millimeter pockets with vertical bone loss and furcation involvement. Tissue displays signs of bleeding, inflammation, and possible pus or suppuration. The recommendation for this patient would be scaling and root planing where indicated, 3 to 4 month periodontal maintenance recalls, use of a powered toothbrush 2 times a day for 2 minutes, flossing daily, and also considering an antibacterial mouth rinse and or water pick. A patient presents with advanced periodontitis. Indications for this would be greater than 6 millimeter pockets with advanced bone loss, furcation involvement, and mobility of the teeth. Tissue displays signs of bleeding, inflammation, and possible pus. Bone loss is evident on the radiographs. Our recommendation would be scaling and replaning where it's indicated. 3-month periodontal maintenance recalls. The use of a powered toothbrush 2 times a day for 2 minutes, with flossing daily. Again, consider antibacterial mouth rinse and or water pick. This patient may also benefit from seeing a periodontist to discuss surgical benefits. As a periodontal overview, periodontal disease is a progressive condition that affects one's oral and overall health. Emerging research indicates a link between gum disease and a variety of other health conditions. These include heart disease, stroke, diabetes, lung infections, and other degenerative diseases, which can be life-threatening. This is according to the American Dental Association. It is important for us to share this with our patients. We want them to know that not only what is happening in the mouth is happening there, but it's also affecting their overall health as well.